हेलो एंड वेलकम फीवर 104 एफएम पर। मेरा नाम है सुप्रिया। आज एक बड़ी ही इंपॉर्टेंट टॉपिक पर मैं बात करने आई हूँ एंड फॉर दैट आई हैव समबडी वेरी इंपॉर्टेंट विद मी इन द स्टूडियो एज वेल। ब्रेस्ट कैंसर, समथिंग जिसके बारे में अवेयरनेस बढ़ाना बहुत ज़रूरी है। चीज़ें पता करना, कुछ मिथ्स हैं उन्हें ब्रेक करना इज़ ऑल्सो वेरी इंपॉर्टेंट। एंड फॉर दैट राइट नाउ हमारे साथ स्टूडियो में है डॉक्टर मनीष सिंघल, MBBS MD DM एम्स ECMO मेडिकल ऑन्कोलॉजी, इंद्रप्रस्थ Apollo Hospital, New Delhi se. So welcome to Fever 104. How are you doing?
I'm very good. Thank you so much.
It's so nice to start the day with you and this very important conversation, Dr. Manish. So, सबसे पहले let's start with what are the most common symptoms of breast cancer and how can women identify them?
Okay, I'll answer the second one first.
Okay.
क्योंकि उसका आंसर थोड़ा सिंपल ज़्यादा है. And self breast examination.
Right.
Is the most important thing. And मुझे ऐसा लगता है कि सारी females they falter over there. After the age of 25 years, immediately after the menstrual cycle is over, a self breast examination should be done by all females. This is the best way to identify anything which is wrong in the breast.
Right.
Right. So self breast examination के बहुत सारे videos available हैं. Anybody can just YouTube it and see those videos how to do it. And उससे आपको पता चल जाएगा कि कैसे करना है.
बिल्कुल.
Symptoms क्या है? Symptoms are any hard mass, पथरीला, in the breast. अगर हम breast को कोई भी palpate करता है तो कुछ lumps तो सबको मिल जाएंगे. Every breast will have some lump or the other. All lumps are not cancerous. लेकिन अगर कोई पथरीला mass है, it's like stone like, very hard, and it is hard to touch. That is one symptom. चेंजेस इन द स्किन, ऊपर की स्किन पे कोई चेंजेस है, पकरिंग है, डिम्पलिंग है, या फिर निपल में कोई चेंजेस आ रहे हैं, निपल रिट्रैक्ट हो रहा है एक तरफ को, या फिर निपल में से कोई डिस्चार्ज हो रहा है, खासतौर पे ब्लड लाइक डिस्चार्ज. और आर्मपिट में भी अगर लंप है तो ऐसा लंप जो कि थोड़ा साइज में बड़ा है, 3 सेंटीमीटर से ऊपर कोई भी अगर लंप होता है तो मैं समझता हूँ कि इस पे आपको डॉक्टरी सलाह ले लेनी चाहिए, छुपाना नहीं चाहिए.
Understood. Absolutely. Also, Dr. Manish, what are the risk factors for breast cancer? और दूसरा question मेरा है, how can actually women reduce this risk?
So, knowledge of the risk factors will help you know how to reduce them. So, one of the most common risk factors. There are certain risk factors जो modifiable हैं, कुछ हैं जो modifiable नहीं है. Like early start of menstrual cycle, late end of menses. ये तो आपके हाथ की बात नहीं है.
बिल्कुल.
Right. Obesity, मोटापा, is definitely a risk factor. Physical inactivity, मतलब आप एक्सरसाइज कर नहीं रहे हो. और एक्सरसाइज ऐसा नहीं कि भी हम सैर करने जाते हैं, सैर वैर नहीं यार, मतलब स्ट्रेनस एक्सरसाइज. अमेरिकन कैंसर सोसाइटी क्या कहती है एक्सरसाइज के बारे में वो हम डिस्कस करते हैं थोड़ी देर में. देन द टाइप ऑफ फूड दैट यू आर ईटिंग. आप प्रोसेस्ड फूड, अल्ट्रा प्रोसेस्ड फूड जिसमें हाई ऑन कैलोरीज हैं, लो ऑन प्रोटीन है, वो आप खा रहे हो तो फिर डेफिनेटली आप मोटापा भी बढ़ रहा है. मोटापा बढ़ेगा तो कैंसर रिस्क बढ़ेगा.
बिल्कुल.
राइट. ओसी पिल्स, ओरल कॉन्ट्रासेप्टिव पिल्स का लंबे समय तक सेवन करना. ऐसे नहीं कह रहा कि आपने 6 महीने कर लिया तो कुछ हो जाएगा, ऐसा नहीं है. दैट इज़ नॉट द टेक होम मैसेज. टेक होम मैसेज, अगर लंबे सिरे तक यू आर डिपेंडेंट ऑन ओरल कॉन्ट्रासेप्टिव पिल्स एज अ प्रिवेंशन ऑफ प्रेगनेंसी एक्सरसाइज. फैमिली हिस्ट्री, दिस इज़ नॉट अंडर योर कंट्रोल. अगर आपकी फैमिली हिस्ट्री बड़ी स्ट्रांग है, आपके फैमिली में कैंसर्स, खासतौर पे ब्रेस्ट एंड ओवेरियन कैंसर्स अगर हो रहे हैं तो फिर वो एक रिस्क फैक्टर है. ऑफ कोर्स ये मॉडिफाइबल नहीं है. पर जो स्मोकिंग एंड अल्कोहल, आई एम नॉट सेइंग स्मोकिंग इज अ डेफिनेट नो. अल्कोहल वंस इन अ वाइल इज फाइन. देयर इज अ सेफ लिमिट विच हैज बीन डिस्क्राइब्ड इन लिटरेचर. सो इसके बारे में अगर व्हाट इज, सो दीज आर द मॉडिफाइबल वंस. तो मैं थोड़ा सा आई वुड लाइक टू ड्वेल मोर ऑन कि फिजिकल एक्टिविटी क्या फिजिकल एक्टिविटी. फिजिकल एक्टिविटी काफ़ी लोग बोलते हैं जी हम सुबह सैर करने जाते हैं. अच्छा, बड़ी अच्छी बात है. कैसे करते हो? टहल रहे हो, गप्पे मार रहे हो? नॉट लाइक दैट. सो द अमेरिकन कैंसर सोसाइटी सेज ओके, फिजिकल एक्टिविटी, स्ट्रेनस एक्सरसाइज फॉर एटलीस्ट 30 minutes every day, 5 days a week. What is strenuous? Running. बोलते जी हमारे तो घुटनों में प्रॉब्लम है, हम तो रन नहीं कर सकते. ओके, कोई बात नहीं. 1 hour of jogging, that is moderate exercise. बोलते जी हमसे तो नहीं होती, हमसे तो जॉगिंग भी नहीं होती. ठीक है, ओके, वॉकिंग, बट देन 2 hours of walking. So as the intensity of the exercise decreases, the duration of the exercise has to increase.
That's actually a very nice way to explain it.
राइट. सो आप ये नहीं कह सकते हम आधा घंटा सैर कराएं. दैट इज नॉट अप्रोप्रिएट. सेकेंड, smoking is an absolute no-no. We should not smoke. Air pollution has been labeled as a risk factor for breast cancer also. We all understand कि इससे COPD होता है, इससे heart attacks हो सकते हैं, etc. etc. But it is also a known risk factor for breast cancer. It is like smoking. So again, this is not modifiable easily. So whatever you can do in your own capacity, but don't take to smoking at all. Especially in this season, definitely not. Okay. And alcohol, so there is a safe limit which has been described for female. There is a safe limit for males. 25 ml of hard drink per day. Okay, but that doesn't mean that you can accumulate कि हमने तो पूरे हफ्ते नहीं पिया, अब मैं पूरी बॉटल खत्म कर दूंगा. No, not like that. So 25 ml of hard drink or 1 pint of beer or 1 glass of wine for a female, and just double the amount for a male.
Got it.
Okay, so that is what, and I'm not sounding misogynist. I'm allowing males more, but this is how the genetics are. So this is a safe limit. So no binge drinking, limited alcohol consumption in case you choose to drink, no smoking, and good physical exercise and intelligent eating can definitely prevent breast cancer.
Well, that's actually very well explained, doctor. क्योंकि इतने अच्छे से कभी किसी ने break down नहीं किया है हमारे लिए.
This is given in the book. I'm just quoting the book.
Yeah, I'm guessing a bunch of us are misreading the book, but here we are, and you really explained it really well for us. Moving on, the celebrity impact on the awareness of breast cancer, and as we see, we have Angelina Jolie's, decision of breast removal surgery, and the impact it had on breast cancer awareness, and what lessons can women learn from this particular experience?
So of course, celebrities have contributed a lot, and I would say thanks to all of them.
Yeah.
I don't know how many of us know about the Angelina Jolie story. कितना हमें पता है उनके बारे में कि उन्होंने ऐसा क्यों कर दिया. But she had a very strong family history. She had almost, if I'm not wrong, around 5 members with breast and ovarian cancers in her family. She tested positive for BRCA mutation, BRCA mutation. This is called as BR means breast cancer gene, which is present on chromosome number 17 and 13. And this gene was abnormal in her, which had put her lifetime risk to get cancer at around 80%. The 80% चांस है ब्रेस्ट कैंसर होने का उसको लाइफ टाइम में जेनेटिक एबनॉर्मलिटी की वजह से, और अबाउट 45% chance of having an ovarian cancer. So she got both the breasts removed in the first go, and in the second go she got both the ovaries removed. And this is a standard recommendation. If somebody walks in my OPD, says कि भाई हमारे फैमिली हिस्ट्री में ऐसे ऐसे कैंसर है, डॉक्टर ने हमें ये सजेस्ट किया था, ये ब्रेका म्यूटेशन देखो, मेरा ब्रेका म्यूटेशन, दिस इज द रिकमेंडेशन आई वुड गिव टू देम ऑल्सो. सो इट्स नॉट दैट अ सेलिब्रिटी हैज डन इट. So it's for everybody who's carrying a mutation. Right. The second option she had is to do very strict surveillance. फिर वो आपको हर 6 महीने में कुछ MRI कराना है, फिर वो कराना है. That is early detection. Removal of breast is prevention. So prevention, an ounce of prevention is better than a pound of cure. So prevention is better. But of course, it's very heartening for a female to get both the breasts removed. Then, of course, she's a celebrity. She can get it reconstructed, etc. But everybody cannot do it.
That's true.
So we advise those patients जिनका ऐसा कोई mutation है, जिसकी वजह से family risk is very high.
Yeah.
We advise them, okay, either you get them removed or you do बहुत strict surveillance में रहो, like surveillance cameras. Same way, surveillance of medical. आपको बार-बार check कराना है.
Strenuous, I'm sure.
Yeah, but then if you have a gene, you can't change your gene.
You can't.
Yeah.
True.
Otherwise, our Indian celebrities, which they promote, okay, they have got cancer. So I think that's also very good. What they have done, they're not shying away from it. So many females who ever get breast cancer, they lose their hair. So it's not that you get cocooned into your own world कि अब तो मैं निकल ही नहीं सकती बाहर, अब मेरे साथ तो ये देखो क्या हो गया. I think these celebrities are helping these females come out, say it loud, okay, है भाई है कैंसर है, कोई बात नहीं, I'm just same as you all. इतने सारे सेलिब्रिटीज को भी तो होता है, तो मुझे भी हो गया, आई कैन recoup from here.
बिल्कुल.
So I think they are sending very good messages, and this is definitely helping patients recover faster. अगर ये ठीक हो सकती है तो मैं भी ठीक हो सकती हूँ, etc. etc. So all those thought processes, those positive thought processes is very important to fight this journey.
Absolutely. You have celebrities like Tahira Kashyap, you have Hina Khan now, and I think all of them are like leading with a lot of hope.
Yeah, so I think they're sending a very positive messaging to the community.
True.
That is just another disease and we can all come out of it.
Bilkul.
And we should fight it.
Bilkul. Absolutely. So when it comes to screening and detection, what is breast cancer screening and how is it essential for women, doctor?
So I think the first, easiest, cost-free screening is self-breast examination. Okay,
Right.
that's the primary thing. Second comes after the age of 40 years. After the age of 40 years, if you don't have any family history or any high risk genes, etc., then after the age of 40 years, a mammography once in a year to once in 2 years. The school of thought is different. Europeans कहते हैं once in 2 years, Americans कहते हैं once in a year. It's okay. At least some awareness is there that हमें mammography कराना है.
Correct.
But that doesn't discount self breast examination. That you have to do. वो तो करना ही करना है.
बिल्कुल.
भाई मैमोग्राफी तो आप साल में एक बार कराओगे. मान लो आप हर जनवरी में करा रहे हो. जून में कुछ हुआ तो
बिल्कुल.
सो वो सेल्फ ब्रेस्ट एग्जामिनेशन तो हर महीने कर सकते हो ना आप.
बिल्कुल. बिल्कुल.
सो दैट इज द टेस्ट. अगर किसको हाई रिस्क जेनेटिक्स हैं देन एमआरआई ऑफ द ब्रेस्ट इज द इन्वेस्टिगेशन ऑफ चॉइस.
Got it.
सो दिस सिंपल.
Could you also explain what's a mammogram?
Mammogram is nothing but a simple X-ray of the breast taken in two views. One is a lateral view and one is a oblique view or a up and down view. So it's just a simple, as you take an X-ray of the chest, same way you take an X-ray of the breast. The breast is compressed between two plates and it's slightly painful, but it's a momentary pain. So I think that is what we do.
All right. Okay. So moving on, we talk about treatment and management now, Dr. Manish. What are the new treatment options that are actually available for cancer patients?
So I think breast cancer is one of the most common cancer.
Right.
If you lay all cancers on one table, so breast is the most common one. So a lot of research has happened in breast cancer. It has laid the path of drug development for other cancers,
Right.
right? Because उन्होंने बोला कि ये वाली कैंसर जीन अप रेगुलेटेड है तो उसके अगेंस्ट उन्होंने दवाई बनाई, वो सक्सेसफुल हो गई तो लोगों को लगा ओके ये वाली दवाई तो फिर यहाँ पे भी यूज़ हो सकती है. सो इट हैज़ लेड द पाथ ऑफ सक्सेस फॉर अदर कैंसर बिकॉज ब्रेस्ट इज़ वेरी रिसर्च्ड कैंसर.
Right.
सो नॉट टू से दैट ओल्ड ट्रीटमेंट इज़ डेड. हम आज भी बहुत सारी कीमोथेरेपी करते हैं ब्रेस्ट कैंसर पेशेंट्स के लिए. सर्जरीज होती हैं, रेडियोथेरेपी होती है, बट देर आर लॉट ऑफ न्यू ड्रग्स विच हैव कम अप एंड जनरली दीज न्यू ड्रग्स आर अवेलेबल फॉर लेट स्टेज कैंसर्स जहाँ सर्वाइवल लेट स्टेज मीन्स स्टेज 4 जहाँ क्योर नहीं होता. वहाँ पर जहाँ पहले सर्वाइवल 1.5 ईयर था वहाँ पर इट इज़ इंक्रीजिंग टू 5 years, 7 years, 8 years. And there are certain patients who can go even beyond 10 years with these new drugs.
Right.
So all these new drugs are labeled as immunotherapies which boost your own immune system to fight against cancer. आप ही का immune system से cancer से लड़ाते हैं. Targeted therapies. There are certain genes or there are certain receptors which are present only on cancer cell. सिर्फ cancer cell पे आपके normal cell पे नहीं है. तो वो target therapy target को attack करती है तो आपको side effect कम होते हैं. Side effect कम होते हैं तो आपको रिस्पॉन्स भी ज़्यादा मिलता है और साइड इफेक्ट भी कम. देन कोलेटरल डैमेज भी कम हुआ और इफेक्ट भी ज़्यादा मिला.
बिल्कुल.
और नाउ द न्यू थिंग विच इज़ देयर इज ADC, दैट इज एंटीबॉडी ड्रग कंजुगेट. अगर कोई टारगेट है उस टारगेट के साथ में आपने एक कीमोथेरेपी ड्रग अटैच कर दिया. जस्ट इमेजिन द टारगेट इज गोइंग टू फाइंड द टारगेट वेयर द टारगेट इज देयर एंड इट इज ओनली ऑन द कैंसर सेल. नाउ I can deliver more chemotherapy just close to the target. So it's basically a chemotherapy drug attached to a target therapy. And then you are able to deliver the chemotherapy right at the level of the targets. Again, collateral damage कम है.
Yeah.
And damage to the cell is much more. So now we have got ADCs which have 8:1 payload. Payload means payload is of the chemotherapy drug.
Right.
In the ratio of 8 antibody के ऊपर 8 chemotherapy drugs लगाई हुई हैं. And you can payload and you can bombard the tumor.
Right.
Such therapies have got unprecedented results. Means it is 5 times, 6 times better than the previous ones. And the entire development is happening in this direction in breast cancer now. They are trying to find more and more targets and they are trying to prepare more and more lethal ADCs, antibody chemotherapy conjugate.
Right.
So you are able to deliver the chemotherapy there where the target is.
बिल्कुल.
तो आपको साइड इफेक्ट हो ही नहीं रहा and you are getting almost 99% cell kill.
That's brilliant.
So that's exactly where the science is moving. Of course, these are learning days. There are already drugs which are approved by US FDA, and the science is moving very fast. बहुत तेज चल रहे हैं to achieve, very deep responses, even in late stage cancers. Of course, जैसे जैसे कोई drug स्टेज 4 में सक्सेसफुल होती है, वो स्टेज 3, स्टेज 2, स्टेज 1 में आने लग जाती है.
बिल्कुल.
And I'm sure that where the trajectory of growth is, it is quite possible that in early stage cancers we will likely to hit very near to 90%, 95% cure rates.
Right.
And even in late stages, the survival rates are going to improve unprecedentedly. I mean, never seen before.
That's great to know, sir. But when it comes to breast cancer and its treatment and the certain, long-term side effects that survivors experience, ऐसे में how to maintain overall well-being for the survivors?
So I think, of course, this is basically survivorship problems.
Right.
पहले लोग बच नहीं पाते थे. कैंसर हुआ, 2-3 साल निकले, demise हो गया, sadly. But now people are surviving.
Yes.
And now you have the complications of survivorship. भाई आप जिंदा बचोगे तभी तो late complications of treatment आएगा.
बिल्कुल.
अब लोग they are surviving.
Yeah.
So we are definitely facing problems of survivorship. So they have neuropathies, they have skin problems, etc., etc. So now the theory is more development of such ADC-like drugs which are more specific, doesn't give you collateral damage, then the problems of survivorship decreases. But there are still a lot of problems. Fatigue, bone loss, etc., skin issues, digestive issues. So I think there is no one treatment. Of course, it is a mixed bag. So there's mixed treatment. So based on what problems. And I think oncologists should be receptive to listen to these survivorship problems and find solutions to it.
बिल्कुल.
And I think in this entire thing, if you are physically fit, you can endure most of these problems quite well.
Right.
अगर आपकी सहन शक्ति अच्छी है, और वो कैसे होएगी सहन शक्ति अच्छी? दिमाग से नहीं, फिजिकल इंड्योरेंस लेवल. अगर आज मैं किसी को कहूँगा ओके आज कारगिल चढ़ना है, तो चढ़ पाएंगे क्या? नहीं चढ़ पाएंगे ना, थक जाएंगे, सांस फूल जाएगी. अगर हम आपको बेस कैंप पे तैयार करेंगे 6 महीने के लिए, तो आप चढ़ पाओगे.
बिल्कुल.
आपके इंड्योरेंस लेवल बढ़ गया. दिस इज एक्जैक्टली व्हाट आई एक्सप्लेन माय पेशेंट्स ड्यूरिंग द कीमोथेरेपी. डोंट सिट हाय मैं तो बीमार हो गया, मैं तो पड़ गया बिस्तर पे. You have to keep exercising. There are now studies which have been done. I was in Barcelona recently, and this was European Society of Medical Oncology, large meeting, 50,000 delegates across the world. And the OptiTrain study was there. OptiTrain. Very nice study, very simple study. It's not easy to do such a study because, so they had 3 groups. One was usual care, आप आए, कीमोथेरेपी लिखवाई, डॉक्टर बोला ओके भाई थोड़ी एक्सरसाइज किया करो, घर चले गए. Third group, they did intensive aerobic exercise to all of them. Okay, कि आपको करनी है, उनको घर से बुलाया कि करानी है. Okay, पूरा प्रोफेशनल एरोबिक एक्सरसाइज जिसमें क्रॉस ट्रेनर एंड रनिंग ऑन द ट्रेडमिल एटसेट्रा. थर्ड ग्रुप स्ट्रेंथ बिल्डिंग एक्सरसाइज इंटेंसिव. ओके, दिस इज मसल बिल्डिंग.
राइट.
आपको वेट्स उठाने के लिए, वेट लिफ्टिंग एटसेट्रा. अमेजिंग रिजल्ट. दीज आर अर्ली ब्रेस्ट कैंसर, आई एम टेलिंग यू. ओके, इफ यूजुअल केयर वाज देयर बेस लाइन, द एरोबिक intensive aerobic exercise patients had 15%, 15% decrease in the risk of cancer coming back.
Wow.
Okay?
Yeah.
15%. This is not the climax, okay? The climax is still awaited.
Okay.
The group which did strength building exercise, that means muscle training.
Right.
मैं नहीं कह रहा डोले शोले बनाने, but muscle training means strength building exercise, had an 80% decrease in the risk of cancer coming back.
Wow.
This is the climax. Wow. And I always used to believe it. मैं हमेशा समझता था कि ये सही होना चाहिए, but there was no proof. Australia, Canada, Sweden participated to do this study. They collaborated to do this study. आसान नहीं है. जो यूजुअल ग्रुप है उसको मैं नहीं कह सकता आपको जिम नहीं जाना, आप क्यों आ गए भी, आप वापस जाओ. You cannot control the control group.
Yeah.
But yet the group which did it, they did it nicely. They ensured. अब कोई नहीं आ रहा जिम, बोले मेरे को नहीं करनी स्ट्रेंथ ट्रेनिंग, तो आप क्या कर सकते हो? आप नहीं कह सकते नहीं आपको आना है, आपको ये लो डंबल लो उठाओ. So it's not easy, but still they showed such a huge difference. If this was a drug with 80% reduction in the risk of cancer coming back, I'm sure this would have been sold for almost 10 lakh rupees per dose or something like that. Okay?
Yeah.
But this is self-training, self-discipline and training. This is amazing. Why it should happen like this? What is the reason? I think that, see, cancer cells are growing cells. वो आपके cells में multiplying cells हैं. तो आपने खाना खाया, आपका सारा न्यूट्रिशन कैंसर सेल ले गए. आपकी बॉडी में और कौन से सेल है जो ग्रो कर सकते हैं? आपकी आंखें ग्रो कर सकती है? नहीं कर सकती. जवान ग्रो कर सकती है? नहीं कर सकती. जवान चल सकती है? ग्रो नहीं कर सकती. लंग्स ग्रो कर सकते हैं? नहीं कर सकते. हार्ट ग्रो कर सकता है? इंटेस्टाइन नहीं. मसल ग्रो कर सकती है if you train it.
Right.
So you are basically depriving the cancer of nutrition by diverting the same nutrition to your good cell, which is the जो आपकी मसल सेल.
Muscles.
तो मसल तो ग्रो कर सकती है. हम सबको मालूम है, टाइगर श्रॉफ, सलमान खान, एटसेट्रा, बिग मसल्स. So if you're training your muscles, you're basically depriving the tumor of its nutrition and diverting the same nutrition towards your healthy cells. तो कैंसर सेल अपने आप वीक हो रहा है ना.
बिल्कुल, बिल्कुल.
So I used to believe this for years together. I used to tell my patient कि यार muscle training करो. Buy dumbbells today. Buy some stretch bands, etc. Start doing it. But it's not easy. I can only motivate them. करना तो आप ही को पड़ेगा.
I mean, वो will power तो
हाँ, आपको अंदर से लानी पड़ेगी.
अंदर से लानी पड़ेगी.
So this improves survivorship problems also.
But that's good to know.
Yeah.
It's really good to know.
So neuropathy is something which still happens with chemotherapy. We can't really avoid it. कोई तोड़ ही नहीं है. I tell them, देखो तुम्हारे पास 3 चीजें हैं. Bones, muscle, nerves. Nerves weak हो गई, right? These are your 3 pillars.
Yeah.
But strengthen your bones and muscle. तो आपको जो डेफिसिट है वो समझ ही नहीं आएगा. फिर बॉडी आराम से कोप अप कर लेगी.
बिल्कुल.
To strengthen your muscles. So this is how I think there are some answers. There are some things which we don't really have answer to survivorship problems, but we are trying. Science is trying to find them.
Yeah.
But yet, I think having a good endurance level at baseline and maintaining it during your treatment is likely to do away with the survivorship problems also.
Absolutely. Moving on, we'll now go towards the myth busting and misconceptions around breast cancer. तो common myths क्या है या misconceptions क्या है breast cancer के बारे में that you'd like to break today, and of course what facts should the public know?
Well, the list is very long. There are so many varied misconceptions. The list is long. जब आप सुनते हो तो आपको लगता है हाँ ऐसा भी होता है, ये भी सोच सकता है कोई. So I think the list is long. I can't really think of the common ones are sugar खाने से कैंसर बढ़ जाता है. अरे बाबा नहीं बढ़ता है. Sugar is something which is normal. Of course, don't overdo it.
True.
It's not that sugar गई और अंदर सीधा कैंसर सेल को पहुंच जाएगी. आपके सारे सेल्स को शुगर चाहिए भाई. Right? Your brain survives only on sugar. Brain cannot metabolize even fat, protein or anything. Just simple sugar. Okay? If you're hypoglycemic, if your sugar level goes down and you remain hypoglycemic, यानी आपकी sugar level 40-50 के आसपास है, you are dead in 4 hours. Right? So sugar is not that bad. Some people think, पता नहीं, I don't know where this concept has percolated down कि being sugar नहीं खानी चाहिए. Sugar moderation में आप खाइए. ठीक है, आपको नहीं खानी and you are okay with that thought process, तो इट्स ओके, आप मत खाओ. बट आप सारा टाइम ये बोलो शुगर नहीं खानी क्योंकि कैंसर वापस आएगा, शुगर नहीं खानी क्योंकि कैंसर वापस आएगा, शुगर नहीं खानी. यू आर री इन्फोर्सिंग योर कैंसर सेल्स. यू आर री इन्फोर्सिंग द थॉट प्रोसेस दैट कैंसर वापस आ जाएगा. मुझे लगता है वो ज़्यादा प्रॉब्लमेटिक है रादर देन ईटिंग शुगर. इससे तो भैया तुम शुगर खा लो. भूल जाओ सब कुछ. फ्री, बी फ्री. Then
that's another level of mental pressure आप ऐड कर रहे हो ना. You might just attract it back. You
हाँ,
don't know.
मतलब खाने का मन कर रहा है पर वो कैंसर वापस आएगा. तो you are reinforcing that thought process. कैंसर वापस आएगा.
Correct.
You are manifesting it every day, every moment.
Yeah.
So I think that's not a great idea.
Yeah, thought play is also quite important.
Exactly. So
during
I
that,
don't think so. That's a great idea.
Yeah.
Second is there are now एक वो celebrities. Okay, celebrities are promoting alkaline water. I don't know where this concept is coming from.
With
alkaline
black water.
The black water.
Yeah.
My son bought black water. I was crazy at him. Why did you buy it? I've been telling the world don't drink black water. There's no sense in it.
Yeah.
So I don't think so. There is any sense of drinking alkaline water. It doesn't really help. There's no way your pH of the body can change. It's already set at 7.35 to 7.45. And there's no way you can become acidic or you can become more alkaline if you drink alkaline water.
Right.
So there is no sense of taking alkaline water or getting those machines installed, which is like 1.5 lakh rupees alkaline water. अगर एल्कलाइन वाटर इतना अच्छा है तो फिर वो जो हम सुबह कहते हैं नींबू पानी में थोड़ा सा शहद डाल के ले लो, बड़ा अच्छा है आपकी सेहत के लिए, वो तो एसिडिक है बाबा, वो तो फिर पॉइजन हो गया. एंड टॉयलेट क्लीनर का जो पीएच होता है वो 9 होता है, वो काफ़ी एल्कलाइन है. दैट शुड बी वेरी गुड फॉर यू. So I think there is no sense of taking this alkaline water. The myth. Robert O. Young was the person who wrote a book, the pH Miracle book, in the US way back in 2012. It was a hot-selling book, and then people complained about him. He served 3 years in the US jail and paid almost $100 million as fine. Okay. This is on the pH Miracle book, like propagating pH diet and a pH water, etc., or alkaline water, and saying that this can cure your cancer. There's no such thing. No such thing.
Got it.
Microwaves, hand phones, your radiation coming out of the phone, all these are another misnomer. I don't think so that microwave or heating food in microwave has anything to do with your cancer cells, nor is the radio frequency which is received in your phones.
Got it. We're going to move on and jump to the part where I ask you questions, jiska answer aap yes or no mein denge.
Okay.
These are quick questions that basically raise our awareness towards breast cancer. Very important. So are you ready, doctor?
Yep.
Let's go. First question. Is breast cancer contagious?
Absolutely not.
Okay. Does wearing a bra increase cancer risk?
Absolutely not.
All right. So I'm going to extend this question a bit. There are these things where a lot of people say, that certain kind of bras, when you wear underwires or something, and that's also, a problematic issue. Is that true?
So, underwired undergarment, if it is causing a continuous abrasion,
right,
or irritation on your skin, underneath the breast, can cause skin-related problem, but not breast cancer. So any chronic irritation is bad. हम तंबाकू खाते हैं, लोग तंबाकू रोज यहाँ रखते हैं, वो वहीं के वहीं रखते हैं, गाल के नीचे, जीभ के नीचे, एटसेट्रा. इट्स अ क्रॉनिक इरिटेशन. एनी क्रॉनिक, दांत खराब है, टेढ़ा है, जीभ को टकरा रहा है, क्रॉनिक इरिटेशन कर रहा है, इट कैन रिजल्ट इनटू कैंसर, बट द लोकल कैंसर. So that underwire thing can cause skin cancer or something related to that, but not breast cancer.
Noted. All right. Can men get breast cancer?
Yes, the chance is very less. Of all breast cancer cases, 1% are male breast cancers.
1% are male breast cancer?
Yeah. If there are 100 women, one would be male.
All right. Okay. Does family history guarantee breast cancer?
Absolutely not. It's only a risk factor of breast cancer, but a strong family history with genes positive is not a guarantee to get breast cancer. It's only a high risk of getting breast cancer.
Noted. Exercise reduces breast cancer?
I just answered it. Yes. A big yes.
All right. Is smoking associated with breast cancer in women?
Yes.
Yes. All right. And finally, alcohol increases risk of breast cancer?
It does. But limited consumption is okay.
Noted. Thank you so much, doctor, for being with us today and answering
My
so
pleasure.
many questions, breaking so many myths. We learned so much about breast cancer. There's more awareness. I think there needs to be always more talk around this. And any message for our listeners out there today?
I think life is great and be positive. I would only suggest that one way to beat not only cancer but many other illnesses is being physically active.
Right.
And physically active will make you physically attractive also. Thank you.
Absolutely. Thank you so much, doctor.
Thank you.